Hi everyone, this is Garner here. I'm a doctor of physical therapy. I'm also an athletic trainer. I've been doing yoga for a couple of decades, over 25 years, and using it therapeutically. I had a recent question about Warrior 2. The question was based on whether or not, what's the back leg doing in Warrior 2? And no, I did not include that pose in my book, Medical Therapeutic Yoga, because the poses that are in that book are all foundational poses, and Warrior 2 branches out past that and has more degrees of freedom or variables in it. So I just wanted to take a quick minute and explain Warrior 2 to you guys. Now, my disclaimer statement is you can do Warrior 2 however you want to do it. However, if you're coming to see me as a physical therapist, or you're an athlete trying to prevent injury, or you're rehabbing from an injury, I work with a lot of people with pelvic pain, hip pain, low back and sacroiliac joint pain. If you're one of those people who've had an injury in the hip, or you're trying to preserve the hip joint or the pelvis itself, then this is the way that I would suggest that you try and play with Warrior 2. Keeping a sense of humor, knowing your boundaries, right? Not getting all serious and rigid about it. So again, do Warrior 2 however you want it. But if you're gonna come and see me, or you're gonna talk about hip joint preservation and pelvic girdle preservation, then we need to talk about Warrior 2 in this way. All right, here we go. Now I have my shoes on. If you have a lower quarter injury, meaning foot, ankle, knee, a lot of times I'll recommend that people do wear their shoes on the yoga mat. So it is okay to wear your shoes on the yoga mat. This morning, I'll do it with and without, just to show you the difference. I'd like for you to start with mountain, at mountain, on mountain, however you want to label that, describe it. And feet are not together, okay? For hip issues, you need to have your feet comfortably hip width apart, not together. When you come into chair, I want you to get what's called a hip lock involved, okay? The reason I'm saying this now is it matters for Warrior 2, okay? You can't just kind of go into Warrior 2 and then align it without thinking of these foundational principles. So as you come into chair, I often describe something called a hip lock. If you have my book, you can look that up in Medical Therapeutic Yoga. It'll more than explain what I'm talking about. The quick way of getting and understanding a hip lock is to press the knees into the hands, and you'll feel muscles pop under your sit bones. The other way that you can feel a hip lock as you come into chair is to reach back, and I want you to make the muscles of the hip, under the hip your sitting bones pop under your fingers, okay? You'll feel muscles pop here, that's your hip lock. Then I want you to lunge it back and point your feet towards me. Bend your knees for a minute. Look down. We're going to do a Warrior to the right first, and then I'll take my shoes off and we'll do it to the left. The reason I have you come into Warrior 2 like this is specifically for hip joint preservation and knowing your limits. Let's just say you can't get to me or another, hip specialist, physical therapist. How do you know where your feet should be in Warrior 2? Well, you really don't. But if you do it this way, you'll be closer to knowing what your anatomical limits are. So I want you can bring your hands to the floor, you can bring them to the block in front of you, or a chair, or a ball, right? I could do this. I want you to turn that front foot out only as far as you can without lifting that bottom heel. Now I want you to draw a line from the heel, so I'm gonna have to move my foot a little, to make it bisect the back arch. This is the anatomical limit of my hip. I cannot go any further out. And then I stand up. When I do that, my pelvis is still facing you, right? It is not triplanar. That's a triangle pose position. It's something slightly different. It's also an extended side angle position. And this is, again, for hip joint preservation, pelvic girdle preservation. If you already feel pinching here, please bend both knees. Do you see how I can sit here? I could actually sit on this ball if I wanted to and explore being able to swim the pelvis around, right? So if I was going to use the ball, I'm right here. Okay, I know the limit of my hip. I cannot turn my hip out any further than that without twisting my knee or really overly doing it with the foot, okay, and turning it too far out. I want my knee and my foot in the same plane. This leaves my pelvis free to explore. I don't feel any hip impingement, no jamming in the SI joint, no jamming in the facet joints. Awesome. From that point, this is your warrior two. You're just simply standing. So when I stand, I can move in and out of warrior two. And what are my hip joints doing specifically? Well, if you look at my pelvis here, if the leg bone, the femur, moves straight out, what is that? Hip abduction. It is not extension. And there are some books that say put your hip in hip extension. Like I said, you can do warrior two however you want, but if you're talking about pelvic girdle, SI joint, low back, and hip preservation, we're not using hip extension, okay? We are using hip abduction. Same thing here, you're going to get some hip abduction and some external rotation, but not end range external rotation, okay? Please, we want to preserve the hip joint, particularly if you don't know what your hip measurements are. I would screen those if I saw you in my clinic, but without seeing you, you don't know what your limits are, and you want to preserve the cartilage in your hip. It's called the hip labrum. So I can come in and out, and I'm feeling like more weight's on my front foot. So I'm going to deepen this lunge a little bit. I'm in more hip abduction here. My pelvis is still square, and I can come in and out of warrior two without hanging on the Y ligament. That's what hip extension does. That's why I don't use hip extension in warrior two. I'm not even going to demonstrate it because it does wear and create tensile force on the Y ligament in the hip by shoving the hip forward. It's also a lazy posture for warrior two. This is way more difficult musculoskeletal strength building wise than hip extension. If I did hip extension, and I'll just pretend to demo for a second, then I put my pelvis in a triplanar position. I'm hanging on the ligament in the front of the hip. I'm dumping my ASIS here, this side of the pelvis, out on the femur. It takes no effort for me to stay here. I could stay here forever. I'm also torsioning the SI joint and jamming up the facets in my spine. But if I simply bring it back to where I aligned you, none of that's happening. And it's actually strengthening the legs more than in the lazy position, okay, that lazy version. So that's it. That's it for warrior two. You can put your arms into, I use an arm spiral if you want to use that. It's a co-contraction of the upper quarter. And if I were to take my shoes off, honestly, there isn't much difference if I don't have a foot injury, right? But I work with patients all the time who have plantar fasciitis and Achilles tendonitis and several things like that. Or they have a lot of arthritis in their great toe joint or hammer toes or other things like that, it just makes it more humane to do a pose with their shoes on, to do the practice with their shoes on. So with my shoes off, same thing. Mountain, feet apart, doing all your grounding and all that stuff that you know to do, hugging the bones of the legs with the muscles. I come back into chair, I pop those muscles of the sitting bones into my fingers. I'm gonna lunge it back, turn towards you, point my feet straight ahead, bend my knees, swim my pelvis around, and I'm checking here for no impingement, no pinching, no pelvic pain, nothing funky going on in the hip. When I bend forward, I'm gonna turn that foot out only as far as I can go without lifting the heel. And then I'm going to put my heel, you may have to move your foot a little bit to put your heel in line with your back arch. Then as you stand, check, no impingement. Bend both knees if you want. You can slide and swim, I call this swimming the pelvis around. If you have any impingement, keep both knees bent. For a long time, I had hip impingement due to a congenital defect. This was my warrior two. It's harder, actually. You're working the legs in a wonderful way. With a pelvis that's facing me or you, depending on your perspective here, you can straighten the back knee as long as there's no impingement. You can move. I'm gonna deepen my lunge a little bit. I'm going into that hip abduction again, no extension. I am not hanging on that Y ligament because I'm keeping my greater trochanter, the side of the hip, in line with the side of my ankle. It does not matter whether your foot's turned out or forward or in, okay? That's hip comfort, it's up to you. When you get to the front, knee is lined up over the foot, so the foot's not going one way and the knee's going another, in other words. And then you can add your arm spiral. Settle into it, so 50% of the weight in the front, 50% in the back foot. And you have your warrior two. A nice solid position, my leg's already burning, right? As I press out of that, I have adequately worked front and back legs. I can do a warrior that is safe, a warrior two that preserves the hip, the pelvis, the SI joint, and the low back. I hope this has been helpful for you, and I look forward to seeing you next time. If you want to get more free videos, I have some that are paid subscription, but I also have many that are free. To get either set of the video library, you can go to integrativelifestylemed.com. Have a great day.